Welcome, everyone. Thank you so much for joining our onboarding training. This presentation is intended for social workers who are interested in contracting with us on an as-needed fee-for-service basis. In this session, we will cover who we are as an organization and how we work with independent contractors across the US, review some basic requirements and expectations we have for you when joining ISS-USA, and give a few steps to get started. A brief introduction about us. International Social Service, or ISS for short, is a global network of social service agencies dedicated to working on cases involving children separated from their families by international borders. ISS-USA is the US member of the ISS network. We have partners in over 130 countries, each of which operates autonomously. Some are government agencies, while others are community-based organizations or branches of an international network. Despite being part of the same ISS network, each partner functions independently. In each country where ISS has a presence, there is a designated entity that serves as the entry and exit point for inter-country casework. This entity manages cases originating within the country and cases that require services from another country. Okay, a little bit about our case management and how it works. Each year, ISS-USA handles about 400 to 500 services, split between incoming and outgoing cases. In short, outgoing cases are those which originate from US-based child welfare entities where a child in the US requires social services in another country. These cases are referred to one of our ISS partners in another country. This represents about 2/3 of all of the inter-country casework that ISS-USA completes. Regarding the incoming cases, the incoming cases come from other countries when a child protection system is seeking support for a child with a connection to the US. This often involves children in foster care or alternative care settings where a foreign court requests a home study or caregiver assessment. The interstate cases involve cases within the US where a state child welfare entity, such as a foster care agency, needs a private assessment of a parent where the interstate compact is not applicable. Last year, incoming and interstate work accounted for about 150 services across 30 states. Although these cases make up a smaller portion of our overall work, this is the primary type of work that involves independent contractors, which is our focus of today's session. It's important to clarify a few things about what ISS does and does not do. We are not an adoption agency. ISS-USA is not accredited to conduct adoption home studies. If you come across any adoption-related language in a case note, please clarify it with your case manager. The work we handle focuses on family-based placements, such as guardianship or kinship care. We are not either a licensed placement agency. There is no central regulatory body overseeing international kinship placement in the US. Our role is to provide objective assessments based on best practices and applicable laws. We do not legally supervise placements or approve homes. Instead, we provide unbiased reports to help decision makers make informed decisions. Thirdly, we are not child protective services. While some ISS partners work within their national child protection systems, ISS-USA does not. Local CPS agencies generally do not take on interjurisdictional work unless there is a reportable incident that mandates their involvement. Our services are contracted privately to support decision-making in such cases. If we receive a report of suspected abuse or neglect, we handle it directly rather than involving our contractors. Lastly, we are not social work supervisors or a training institute. Our contractors must be appropriately credentialed and capable of conducting independent social work assessments without extensive supervision. We provide support, templates, and training, but contractors are expected to work independently without significant intervention from the case management staff. A little note about how we define and distribute services and case. When we refer to services and cases, we mean individual services, not a person. For example, a home study is one service, so it counts as one case. A child may have multiple services, and similarly, multiple children can be involved in the same service. For instance, if there is a request for home study on a grandmother in Maryland on behalf of two sisters living in Ireland, that counts as one service for two children. If Ireland also requests 3 post-placement reports after the sisters are placed, that counts as 3 additional services. Each referral we receive results in a new case with its own number and associated fees. If we need additional services for the same family, we will write to you to complete those services, as long as you're qualified. Occasionally, we receive requests for psychological evaluations or other specialized services for which we need to seek outside providers credentialed to complete those assessments. However, if you've already completed the home study, we will typically follow up with a request for post-placement reports if we receive them. Lastly, it's worth noting that there may be different outcomes for children involved in the same case. For example, if a grandparent is being assessed for placement of her grandchildren who are half-siblings, it's possible that one child is placed with the grandparent while the other sibling is placed with their other parent. We will now touch on services we seek contractors for. The primary services we need completed are home studies. We have a detailed training on home studies available on our YouTube channel. Please be sure to review that one before completing a home study for us. If you are familiar with the home studies for adoption or foster care licenses, this is good background, though note that we require fewer documents and visits than in those settings. For example, we require only one visit for home studies and do not require personal documents such as birth certificates or marriage certificates. Nor do we require detailed financials, just general verification of income. We also do not require medical clearances. If you feel you need more visits or information in order to make a recommendation, you may request those at your discretion, though health information is subject to HIPAA protections, so please check with your case manager about this when seeking additional information. The templates we use are similar to other home study settings but require less time and fewer visits. Regarding background checks, they are a required part of a home study. Please review our detailed training about this on our YouTube channel. Despite the requirement as part of a home study, individuals working under their own license typically cannot obtain these checks or others. It's usually the family responsibility to get them done, though we ask you to help orient the family and follow up to ensure they are working on it. If background checks are not completed by the time you submit your report, we ask that you make your recommendation conditional until the checks are completed. It is your responsibility to follow up with the family and report on the progress if no background checks are obtained. Other services we request may include community resource assessments, which are general surveys of local services that can be engaged to stabilize a child placement in a new area. We also may request post-placement reports, which are brief updates on how placements are processing. Agencies generally recommend at least 3 post-visit placements. We may also request child welfare checks, which are brief reports on the well-being of a child already placed in a home. Finally, we may approach you about completing other services based on requests of the foreign courts or referring agencies. It's up to you to accept additional service requests, and we will work with you to ensure you have the information you need to complete any additional work. I will now describe how cases are opened. Once we receive a referral or case note, it is reviewed by our inter-country service coordinator, who coordinates with the casework supervisor. Our service coordinator will reach out to you to see if you're available to complete the service, asking for your availability and fees. Please clarify your availability so we understand any constraints, such as distance or time limitations. We do not have preset fees for services. Fees are based on your experience and licensure. cost of living, travel requirements, and other factors. Once you provide a fee, it must be approved by the casework supervisor and by the referring country before the work proceeds. If you don't hear back from us immediately, it's likely because the fees are being reviewed. Fees also need to be designated by service. So if you're being asked to complete 2 services, please assign an individual fee to each. We have a YouTube training on setting fees as well, if you would like to watch it. Once everything is sorted, the case is opened and a case manager is assigned. From then on, all communication will go through the case manager, not the service coordinator. If you need help or have questions about your case, please reach out to the assigned case manager. A quick side note about agencies. In some instances, we contract with agencies who have statewide or countrywide coverage through several providers. In these instances, our service coordinator would reach out to the regional coordinator or listed point of contact with the case information for them to assign to a social worker. Once the case is assigned, it is up to the contracting agency to determine the communication structure, always identifying a point of contact. Ideally, the assigned social worker will work directly with the ISS case manager to manage case-specific issues, with agency staff in copy. When the work is complete, the assigned social worker will send the report to the agency coordinator for review, and then send a copy to ISS-USA. Please remember that the case manager on each case should always be your primary point of contact for all case-related matters. If anyone outside of ISS contacts you regarding the case, kindly refer them to the case manager to keep all communication streamlined and secure. In some rare cases, there may be need for team calls, but the ISS case manager must be present on all communication about the case. This protects both you and the case information. To reiterate, everything case-related should go through your case manager first, but our team has additional support. While your case manager will be your primary point of contact, there is a team supporting this work. Our administrative assistant will assist in getting your personal file in order and will assist with finance-related queries. If you need support with an issue that requires additional attention, the case management supervisor, Katrina Clemens, will get involved. For non-case specific matters, the program and training manager or the intercountry service coordinator can offer general support. Some credentials and expectations we have for you as independent contractors. As independent contractors, we expect you to have the following qualifications: a Bachelor of Social Work or Master of Social Work from an accredited institution, authorization to practice social work in your state. If your state does not require a social work license, we do not require one either. But if a license is required to practice social work, we expect you to be licensed and in good standing. Clinical licenses are generally not required, but there may be rare expectations. You are required to obtain liability insurance before beginning a case. If you are not currently insured, it's fine to wait until you accept a case to purchase, as long as we have it on file ahead of your invoicing. We can provide leads for obtaining insurance, but it should be on file before you submit an invoice. We also expect relevant work experience. This can be completing home studies, work in child welfare, foster care, or other international social work. Please ensure your resume is on file and feel free to send updates as needed. Last but not least, you must possess professional writing skills. All services require writing written reports, and these must be prepared with professional language and terminology relevant to the case. As for logistic and equipment, you must have a personal computer and reliable communication methods. If you use a shared computer, ensure it is password protected. Work should be done on personal devices to maintain confidentiality. You need to have reliable communication to respond to messages from ISS and the family clients in a timely fashion. As contractors, you are also responsible for organizing your own travel and ensuring reliable transportation to family homes. the majority of assessments require in-person visits. Of course, all case details must be kept confidential. Case documentation should not be shared or discussed with anyone outside of the case manager without explicit authorization. While you are encouraged to engage with us on social media in general, do not share case-specific information on these platforms. With regards to the reports, please be sure it is only shared with ISS-USA. If a family requests a copy of your report, it cannot be shared directly without authorization from the referring entity or case manager. Similarly, we will not release reports to the family without explicit consent from the referring entity. You may discuss concerns or recommendations within the content of the report, but please do not share the document. As social workers, you are mandated reporters. If you discover something that requires reporting during the course of your work, inform us immediately so we can notify the international partner and ensure compliance with the necessary regulations. Now, we will talk about expectation and the next steps. As a reminder, anyone providing services for ISS-USA will be contracted on a fee-for-service basis. You will receive a 1099 at the beginning of the year related to the services you completed the year prior. Once we have your documents, you will receive a global scope of work document that outlines the general terms of your contract, but no case-specific details such as dates or fee. This is signed by you and our leadership once, upon getting onboarded. Additionally, for each case, you will receive a case-specific scope of work addendum. This document will include specific information about each case, including the case number, name of the family based on the oldest child's name, the services to be provided, and the agreed upon fee. This is signed by you and our team for each case. There's an expectations form that we share when you get started and should be included with your statement of work that you sign. Please read it. Here are some key points. First, another reminder that all communication goes through your case manager. Except variable caseloads, we cannot predict how many cases we will assign in your area in a given year. It is up to you to accept or decline case referrals. However, if you decline, letting us know why helps us understand better your limits. Assignments are service-specific. We do not expect independent contractors to provide ongoing cases management. That being said, services are considered complete once the case manager confirms the report is complete. We will ask you to complete follow-up as required on a service. For example, if your HS is missing a section or has insufficient information, we will ask you to complete it. Per ISS-USA policy, independent contractors are not required to testify in court. In rare cases, if we receive an official court request, ISS-USA may ask if you are willing to testify. If you decline, ISS-USA respects your decision with no further obligation. If you agree, ISS-USA will advocate for compensation for your time. Payment will be proceeds once your invoice is submitted. Follow-up may be required if a foreign court or other entity asks for additional information or clarification. Next, you control the pace of your work, coordinating with the family to schedule appointments. There are no set deadlines, but we expect prompt communication with families within a few days of receiving the case note. Please also document all efforts in reaching out to the family and scheduling. If you encounter issues reaching the family, contact the case manager for assistance. If a phone number is wrong or they've stopped answering, your case manager can help resolve these issues. A little bit about troubleshooting. Please communicate any scheduling difficulties to your case manager so we can manage expectations. We ask that your report be completed promptly after the visit. If you're waiting for background checks, it's fine to submit the report without them, as long as they are being worked on. However, you should note that your recommendation is conditional and continue following up on receiving the background checks. Remember that if anyone outside of ISS-USA contacts you, please direct them back to your case manager. Please also read the case notes carefully for expectations. If something you encounter in your interview with the family doesn't match up with the case note or doesn't align with your understanding, flag it immediately. Keep in mind that not all case notes will have extensive details, as we get referrals from various sources. And again, document all of your efforts. If a case is cancelled, we can compensate you for your work completed, but we need a written statement of efforts to do so. So tracking how many times you've reached out is important. If you've completed the visit and the report, but the case is cancelled, you'll still be paid for the completed report. Please watch the other trainings on our YouTube channel before beginning your first service. I'll go through a few other general reminders. Please use our ISS templates whenever possible. If a different template is necessary, ensure your case manager is aware so that all required information is included. Follow up to get background checks, document your efforts, and write recommendations accordingly. Reports should be written in narrative form, not as brief bullet points. The templates guide the interview and assessment process. The bulleted questions in the template are not meant to be fully answered in a few short lines. If the report doesn't meet professional standards, it will be returned for revisions. You can ask your case manager for examples if you need them. Unless otherwise requested, all assignments must be done in person. Any exceptions must be approved by your case manager and the referring agency. After submitting your report, your case manager will review it for completeness and may request edits or clarifications. You should be available for any follow-up questions after submission. If additional work is required beyond the original scope, a new case may be opened. Remember, you're working independently, so ensure your report is finalized before submitting. You are responsible for the content and quality of the report. Look back at our training materials to ensure you're meeting expectations. Please double-check the case names are correct, include photos, background checks, and any other supporting documentation. If you are an agency coordinator, please help review for completeness. The ISS case manager will review before sending to the referring agency. Send your invoice to your case manager promptly after completing your report, making sure it matches the approved amount in your scope of work addendum. Invoices should be submitted as soon as possible, ideally by the second week of the month, as payments are processed once a month. Ensure all documentation is correct to avoid delays. Please watch our complete training video on invoicing, though a few key points to remember are that all expenses must be pre-approved through ISS-USA, and incorrect invoicing, such as missing or incorrect case name or case number or invoice amount, or an incomplete personal folder may result in delayed payment. Our administrative assistant may be in touch if there are discrepancies. Regarding outcomes, we may not always know the final outcome of a case. The assessments you are providing are often one in a continuum or part of a larger permanency process of which aren't privy to the full proceeding. While you may perform a positive home study, sometimes the child is placed with another family member or there's another outcome. Sometimes the child is placed in the home but without a request for post-placement. We encourage the process but only receive as much follow-up as the sending party can share. This does not reflect negatively on your work. Your efforts may support other connections or help facilitate communication, even if no placement is made. You are still part of a process that represents inclusivity and due diligence in preserving a child's right to family. Thank you so much for being part of this process. Finally, we may not have a case for you right away, but we'd love to stay in touch. Stay connected with us through social media and follow our activities. You will receive monthly bulletins with updates and other relevant information. If you have any questions or training ideas, feel free to reach out. We are always looking to add social workers to this network. Please spread the word among your social work friends across the country. Thank you for your dedication and partnership in ensuring a child's right to family.